For many of us, our mental health is only skin deep. Cosmetic aesthetic anti-aging treatment might be the solution for you. Dr. Reza, thank you so much for your time. How does cultural and societal perceptions influence mental health?
So of course, in different societies and different cultures, there are different recognitions of certain mental illnesses and a different recognition of mental health, different classifications. And so these things are different in different communities, but some of the things are common. Mental illnesses can be common, they can be very similar in different areas, but mental health is universal. And when it comes to the interplay between aesthetics, between the way people look and feel and their mental health, that is fairly universal. So if people are feeling happy about themselves and the way that they look, this will be reflected in their general mental attitude.
Now, as someone that advocates cosmetic and anti-aging treatments, can you share some success stories and testimonials of your clients?
You know, some of the things that we like to speak about is the research that's out there. And I've done a few posts called The Psychology of Aesthetics. And if you look through them, you'll see a number of studies that have been spoken about, where we look at the different levels that these types of treatments can influence people and their mental health. So for example, botulinum toxin, we know it takes away wrinkles, but injected into your body, regardless of where it's injected, has an influence on your mood. It will elevate your mood. Nobody knows exactly how that works, but it works. The next thing we look at is the feedback mechanism. If you had to look in the mirror and give a big smile, I mean, you can try it right now. You can do a big smile. Yeah. Go ahead, your biggest smile. And you know, you can already feel that you feel different. If I say to you, stop smiling, it's difficult. You can't just stop. And so your brain sees itself looking better and you feel better because your brain recognizes that that is you in the mirror. So it comes to things like the frown, the jowls and saggy face, the under eye circles. And so these things are useful for us. We use that in our practice. We use that for our patients. We never want people to try to replace formal treatment with a psychiatrist or a psychologist with aesthetic medical treatments. Of course not. It is there though to help, and it will help whatever level you're at or whatever the severity of your symptoms, you'll have an improvement. And the third thing is to actually make your life better, because you do get things called reactive depression, where you feel sad because you're not achieving at the level you want to achieve. And that's real. But things like aesthetic medicine, it's quite tricky, but it's real. The effect can be as remarkable as a master's degree. So when you study a master's, your earnings go up. Now, being attractive or deemed attractive by society will give you the same increase in your earning potential, which is quite interesting, but it's a fact. So whether we like it or not, that's the way the human brain works. And we take advantage of that when it comes to the treatments that we use.
Now, we often think that there's a hefty price tag that comes with physical enhancements, but there's a difference. Can you tell us that difference between your physical enhancements and your surgical procedures?
So surgical treatments, yes, they have a price. They have risks and they have prices. And that's why, and good plastic surgeons will tell you the same thing. It isn't the first step. When you've got a little problem, a tiny bit of sagging or lines, the answer shouldn't be surgery. It's quite expensive. It's quite risky. There's a risk of dying with things like liposuction. Well, I think it's just about 3%. But when it comes to the minimally invasive, that is the way we like to start. We start on the outside, we work our way in, and these treatments are not expensive, even when compared to things like good skincare products that you can buy at the shops. The only reason people think that they are expensive is because we don't advertise prices. The reason we don't advertise prices is because we're not allowed to. The HPCSA has a rule that says we cannot, publicize these prices. And so people get the idea that we're not putting the price because it's expensive.
Now, with it being Mental Health Day today, how would you then say that physical enhancements then build your self-confidence and then also build your self-esteem and then trickles into your mental health?
So, I give people an example, and this is the thing I see with many patients, is they'll stand up to give a speech or they'll be doing a sales presentation. They'll look at people looking at them and they'll go, is that guy looking at me or is he looking at the shape of my chin? And that makes people self-conscious. They'll stop focusing on doing the job or doing the best version of their job that they can, and they start worrying about what people are thinking. And the strange thing is just a little bit of fillers, for example, or a little botulinum toxin to stop that muscle, changes that, takes their perception off of their own, what they would see as an imperfection. And all of a sudden they can stand up, they can give the speech, they can do the best that they can do and deliver more, because now they can focus on the job at hand. And so this is something that we like to see in our patients, and it's an experience that people will give to us as feedback all the time, and it's one of the most enjoyable parts of our job.
Now, given your expertise, how would you then enhance my physical and mental health at first glance?
So, the thing is, mental health is not visible, and that's the tricky thing about it. It's inside you, and that's the thing that also adds to some of the stigma around it. But many times people can very adequately compensate for what they're feeling inside and portray a different vision to the outside world. So it's something that does become evident as we work with patients. It's something that as they trust you, they'll reveal more of, and you'll learn more about them. And that's how you can start to tackle the things that bother them the most. Of course, it's our responsibility to refer them as appropriate to a psychologist or a psychiatrist and get them the right level of help. But again, when we see that we can target something that can make a difference to them very quickly with a few injections, and we can change their whole life and perception of life, then we do that. So things like dermal fillers, microneedling, we do things to grow hair, to smooth out skin. Because, sometimes people ask us about when it comes to the cultural view of beauty and attraction, but there are certain things that are universal, things like good healthy skin, good healthy hair. These are, anyone in the world would see that as beautiful. And so we like to focus on that with our patients. And we completely shy away from the overfilled look of patients. We don't want them to look like something's happened to them. It looks like they're trying too hard. It looks like they have made mistakes with their decisions. And so our patients should never look like they've had work done.
Now, these are treatments that a lot of people would like to do, but sometimes are very skeptical. Are there any dangers to it?
There are actually dangers to it. So different levels of treatments will have different levels of danger. So botulinum toxin, the worst that you probably would expect is if they hit the wrong muscles, you can affect your smile, you can end up with droopy eyelids, and that's a temporary problem. But dermal fillers and the overuse or indiscriminate use of dermal filler injected under high pressure, high volumes in the wrong places can actually track up the arteries and come back into the eyes or the brain that can cause blindness or stroke. So it's a very serious thing not to be taken lightly. I think, social media accounts, even like ours, where we show the nice side of it, the results, the glamorous view of patients, people then feel like, oh, this is easy to do. Let me also start picking up a syringe and injecting people. But I think without the detailed training and studying of anatomy, physiology, understanding of the physics and dynamics of a person's face and body, it would be a mistake. And it's also what we like to say, art meets science is our motto. And that's because it is that. It's art and science put together to give you a very beautiful, holistic result. Otherwise, it looks like something's been patchworked together. And understanding beauty and what pretty is the first step, because otherwise, how can you make someone prettier without knowing what pretty is?
And finally, how would you integrate physical enhancements and mental health together? What is your future envisionment for that?
So it's pretty much exactly what we've been doing. We need to take those people, we need them to be open with us, we need to gain their trust as we work. And I sometimes, people will say, why are all your certificates on the wall? Because if you come to visit us, you'll see the walls are covered in certificates. And it's because we want people to have faith in us. We want them to see the level and extent that we have gone through to study aesthetic medicine, to contribute to the field of aesthetic medicine. And that will give them the trust to open up to us and talk to us more openly and be free with their conditions and the things that bug them. And then we can accurately gauge quite quickly, is this something that is real? Is the problem that this patient is seeing real and significant, and are they being reasonable in what they're asking for? Or do we need to start ticking the red flag boxes and considering sending them for some type of referral for professional help and referral? So that's kind of what we're doing, and I think we'll pretty much stick to that because it's a formula that seems to work for us and our patients, of course.
Dr. Reza, thank you so much for your time.
Thank you for having me.